Thank you very much. I'm very honored and appreciate very much to be here today and share the experience of Rwanda on assistive device, or assistive technology, as the title is. So what I want to discuss in my presentation, first is the prevalence of disability in Rwanda, then accessibility to assistive technology, facilitators to accessibility, barriers to accessibility, conclusion and recommendations. According to 2012 population census in Rwanda, the prevalence of persons with a disability was approximately 5%. But that did not include children under 5. The percentage of the prevalence of people with disability was much bigger in rural areas than in urban areas. It was even found out that women were more affected with various disabilities compared to men. And the physical disability was much higher compared to other disabilities. So what is our experience on accessibility to assistive technology? For the whole country, we have 13 workshops, P&O workshops, I mean. And that include public and private workshops. And those workshops produce more prosthetics and orthotics and some crutches. The available assistive essential technology device as per GAID include what I've just mentioned, prosthetics and orthotics and crutches. And additional assistive devices we have in the country come from outside. And this has to go through a heavy procurement, which makes really life of persons with a disability and as professions, life really difficult. We are lucky to have facilitators and opportunities. And among the facilitators, the most important is the policies and laws which are in place. In 2018, Rwanda ratified the convention, the UN convention. And since then, we are seeing policies being developed and laws and regulations being approved and adopted by the government, which is really something very positive. For example, in 2009, the government approved the facilitation to medical care, and that puts persons with disability in categories. So those with severe impairments, they have free of charge access to medical service. Then the second category also pays very little fee. We also have the example of the access to service, or maybe distribution of services, rehabilitation services, which was adopted and approved in 2016. And that has created the rehabilitation services at different levels. We have those services at referral hospitals, at district hospitals, and in health centers, which is also something which has really improved accessibility to assistive technology. I don't know how to go back. Okay, it has come. So, and the plan for service provision is in the Ministry of Health. Another policy which is really important is the exemption to all materials and components used in rehabilitation. So it is tax-free. Then there is a tarification to all assistive devices in physical rehabilitation. So we have a certain tariff, and which is planned in the Ministry of Health. Then the policy of using health insurances to cover rehabilitation services. For instance, persons with a disability use a basic health insurance, which is Mutuelle de Santé, to afford the assistive devices. We also have a middle insurance, which is the Rwanda Social Security Board insurance, that also provides assistive devices at a good price for the middle class. Another important facilitator is the establishment or the development of programs for rehabilitation studies. We have Master of Medicine in orthopedic, in surgery, but with the specialization in orthopedic. We have Master of Medicine in psychiatry. We have we have psychology. We have physiotherapy. We have prosthetics and orthotics, occupational therapy, mental health, ophthalmology, speech and language therapy, which is in pipeline and might start last year. And all these programs, they are offered at the University of Rwanda. Other facilitators to mention, we have rehabilitation centers of excellence. The one center of excellence is in the University of Rwanda, and it is the Center of Excellence in Biomedical Engineering and e-health that has a component of rehabilitation and mobility sciences. And that involves training and service delivery. But also, you cannot talk about training without research. And it's going to offer high standard research using e-health. Then we have Gaini Rehabilitation Center, which is more service delivery. But we cannot ignore the support of the governance, which has established the National Council of Persons with Disability and has given a seat in the parliament for persons with a disability. We have also the decentralization system. So at each administrative level, we have a person with disability representing others. At MINALOC is the Ministry of Local Government, where we have the NCPD, which is the National Council for Persons with Disability. We have a representation. The whole commission is part of the government institutions. Then at district level, we have someone representing persons with disability, and down at sector level, we have someone, and then at cell level, we have a representation. Then the Ministry of Health caters for all service provision, plan, strategic plan for a service provision, all that is done in the Ministry of Health. Despite all the efforts, all the support we have from the government, we have barriers and challenges. As people have said this morning, we also have issue of lack of raw materials in the country. So we import most of the materials to manufacture the devices we are able to produce in the country. Then the cost, it is still high, despite the effort of the government by maybe giving free service or whatever. The price we find is really expensive. Then we have, as I said, the most prevalent is in rural. We have people in rural areas who have to do long distance to reach the service. We don't have enough workshops so far. Most of the centers, they are based in town. Then infrastructure is still a problem. We still have a problem in creating awareness. I think as professions, it is a challenge, or it's something we need to look at. Then the procurement, as I said, is really very heavy and very bureaucratic. Sometimes it takes time, it takes long to get the materials we need because of the procurement process. Then we have the number of professions, which is still low, especially for P&O, because it has just started. We are now going to have the second batch, the second promotion. So we still have to add more, to have more people. And the reimbursement from the insurance, it's only at referral hospitals. So somebody from the center, the health center, has to be referred to referral hospital so that it gets easy reimbursement for the insurance. So what do we recommend per gate, following the gate, which we should really make move? We recommend continuous advocacy. We need really to push our government to advocate and say, hey, this is the essential devices, so we should get it right and have it at lower level, as we are lucky to have this decentralized system. Then, of course, we have collaboration. We have really good partnership with NGOs, but we need to, again, have more so that we could work together and do this advocacy and improve and achieve more. And we thought maybe we could do, when we said in rural area we have more people, so maybe the community-based rehabilitation is a good model to go with so that we go down to the community. We do it, but we need to strengthen what we are doing now. We also need to strengthen the multidisciplinary approaches. I was happy to hear my colleague from South Africa in the AfriNet, the way they have all the professions, all the rehabilitation professions coming together and really achieve what they have achieved today. So we need also to strengthen that area. Then we need to strengthen the intersectoral approach. I've said we have this NCP, the National Commission, in the Ministry of Local Government, but we need to see this National Commission working with other ministries, working with the Minister of Justice, and maybe have more laws, working with Minister of Infrastructure, control. They are doing it, but we need to see more achievements, more actions, but together, working with the Minister of Education and advocate for education for persons with disability. It's being done, but we need to see more and more achievements, gender, ICT, and so forth. We really, as I've said, we really have support from the government. We acknowledge that. We are happy and we appreciate the political will. But we are very grateful to some organizations, I've just mentioned a few, who have supported us in this journey of what we're having now. Thank you very much to ISRC, Handicap International, African Development Bank, which has established the Center of Excellency. We have the Center of Excellency we have in the University of Rwanda, the Biomedical Engineering. CBM, thank you very much, has established the Gaini Center of Excellence. Fred Olos, which is in visual impairment and vision for a nation. One site, you are going to understand, I just had to maybe also mention those who are working on other impairments or other disabilities because of this multidisciplinary. The one site has just established a workshop of optometry at the University of Rwanda. So we are going to produce or manufacture glasses, and we are going to deliver these glasses at different vision centers created in different district hospitals. So the workshop is for the university. We are going to teach students in this workshop. At the same time, we are going to produce glasses and distribute at a lower price at different district hospitals where we have created with a vision, with one site, these vision centers. So I just had to support them. I know we're in physical, but I think in GATE, we are all together trying to advocate for the assistive devices for all. So we have federations, international, Africa, or regional federations. We are so grateful because with the federations, we happen to have these programs for the university, but we also happen to advocate together for what we have achieved to move to the assistive technology for all. We have FATO, ISPO, WCPT, which is for physiotherapists, the UFOT, which is for occupational therapists, and of course, as I'm coming from a university, we have collaboration with many universities in the world. Like in South Africa, we are collaborating with the University of Cape Town and we would like to have more in South Africa or outside South Africa. The list is not exhaustive. We are hoping to have more collaborations, and I've not put all what we have there. Thank you very much, and welcome to Kigali.